Okay. I did some work with Dr. Mann, specialist in hypertension, high blood pressure cases at Cornell Medical Center in New York City. The stated purpose was to remote influence 12 chronic hypertension patients to decrease their blood pressure under laboratory conditions. Each patient had dangerously high blood pressure at the beginning of treatment. Each patient would be remote influenced only once, and the way he did it, he would notify me when a patient was coming in and going under the blood pressure machine, and they would have him on it for 30 minutes at a time. They knew the standard pattern. The standard pattern is that over a period of time, 30 minutes time, this hypertension patient would drop maybe 10 points on the top one. Systolic. I'm not a doctor. On the high one. And now, he would notify me when there was a patient there on the machine. I would flip a coin. If it came up heads, I would do a remote influencing session. If it came up tails, I wouldn't. I just wouldn't do anything. I also made a record of it, but I did not tell the doctor whether I was doing a session that day or not. What he did was he kept the readouts at the end of the project. We compared the times when I did a remote influencing session and the results to the times when I didn't and the results. Okay? So it was a double-blind study. Dr. Mann kept all the data on the patients throughout the study. I kept the data on the remote influencing. Okay. The method I used, I accessed the person normally. I used a visualized analogy, a story, to address the problem. I would manipulate that story to bring about a desired conclusion before stopping. I don't know why these are coming out. Okay. The patients for whom I worked, RI sessions, showed an average drop in blood pressure over the targeted time of 25 points beyond the expected norm. Wow. The times when I did not do sessions, there was no difference from the expected norm.
Could you go back to the last slide just briefly?
I will try.
You used the visualized analogy to address the... Are you going to go over that?
Yeah. Mm-hmm.
Okay.
Yeah.
Never mind.
I have a question, too.
Yes.
You said there was a coin flip to determine...
Whether I would do a session or not.
Okay, so it was randomized in that sense.
That's right, yeah. Mm-hmm. Yeah. Okay, the project was continued with 3 targets per week for 4 weeks. And then we, got our paperwork together and summed it up to try to figure out what would happen. Results. A direct and measurable effect was shown. A dependable effect was shown. The effect was repeatable and dependable. When the patients returned to their daily lives, any effect of that work was diminished and gone. Yeah. As a result of that, the amount of effect was considered enough to potentially save someone's life if they were in a crisis condition, but the amount of effect was not enough to bring patients below hypertension level, and it was not permanent. Therefore, the doctor said, it's good, it shows a result, and I might give you a call in the middle of the night if I have an emergency situation, but as far as working with you over a period of, a whole patient's treatment, I don't see where it would do any good. And I agreed with him. Because whatever their life was that was giving them the hypertension, they went back into it, and it was gone. Okay.